And actually, some of the largest employers these days are states, right? With state employers, also when you think about the programs that they administer and run, like state Medicaid agencies. We were talking earlier about what you're seeing in terms of states being actively involved in value purchasing programs. Can you talk about, there's somewhere in between the federal government and private employers?
Yeah, well, I think it's the irony for many states having expanded the Medicaid coverage to cover the uninsured, realize that the bill for their own taxpayers has increased, and so you need to tackle this issue called healthcare costs in a far more aggressive way. And you have to look at the innovation that's going on in states. It's quite impressive. I think there's very different types of programs that are being tried, being piloted. We'll see where they go. New York State has an incredibly ambitious program, and I think the states will get there a lot faster, for example, than Medicare will at this point, because the pressure is felt more directly. I mean, you've got residents in your state that are saying, whoa, wait a second, we're not going to be continuing to pay, ever more higher taxes, and so the state government has to find a way to react to that.
Right. Ateev, you mentioned a few moments ago about the Me Too kind of approach that private payers are taking with some of these programs that are out there. But you have to keep in mind that a lot of times when the private payers come up with an innovative plan and try and launch it, there's a degree of skepticism out there of there they go again, and it looks very self-serving. Whereas when a program like this comes out of CMS, and behind the scenes a lot of times there is some influence and some of the ideas do come from the private sector, but when it comes from CMS there's a greater acceptance. Very often when the private payers are putting a policy out there or a change of some kind, the very first thing that the payers are asked by the providers is, well, what is CMS doing? What is Medicare doing? And that's the standard that's being used. So there is some of that Me Too, but it's to avoid that self-serving look that is often the way the payers are painted.
And for many services, Medicare is the dominant payer. So if you don't do what Medicare is doing, then it's hard. For other services, maybe there's more latitude for a private health plan.
Yes, but don't forget Medicare also taps a different source for its funding. This is paid from the public with dollars, and there is some cross-subsidization. Some of the money shortfall that would come with Medicare comes from the private sector. So they do have a great deal of innovation. A lot of their ideas are superb, but it is a way to get those things out there in the public so they can be done in a collaborative manner with greater acceptance. I think you're going to find that more and more as the ACA goes forward, that there's a greater collaboration between all the stakeholders. I think everybody's getting a sense that we're all in it together. Finally, we're getting that sense.
So Art, that sounds a little kumbaya-ish, which is great, but you work for a health plan and you have to go out and tell providers about these programs. And to some extent, aren't some of them feeling threatened by this notion that they're not already providing value, or they need to change the way in which they practice to extract greater value? How about plans? You work for Excelis. Do plans feel threatened by these programs?
Well, yeah, thank you. First of all, yes, I'm regional president of a health plan, one I'm very proud of. I'm also a surgeon in practice. I'm also a past president of a medical society, but probably more importantly than any of those, I've been a patient and so have my family members. So you have to take this look, a global look, where really all parties have to work together. In terms of providers feeling threatened, well, when doctors look back on their own experiences, they feel that, their patients are a little sicker than the average ones. And what they're ordering, those tests that they're ordering, are always justified and being done for the right reason. But then when you put it in the context of comparing them to their peers and show them the data, when it comes to providers, you've got to have the data, it's got to be accurate, and they need to be approached in the right way. You don't throw it in their faces. What you do is you sit down, you show them the data, and you come to some conclusions and see what do they want to do about it. You'd be amazed how often behavior has changed based on data and letting the providers take the lead.